Hello, this is Dr. Jim Sharps. I'm the president and CEO of the International Institute of Original Medicine. It's a biblically based school of naturopathy, of natural learning. It's the only accredited biblically based school of its kind, providing both certificate and degree programs, everything from the certified nutrition counselor, certified herbalist, certified medical missionary, bachelor's, doctors, bachelor's, master's, and doctorate, all the way up through PhD program, which we just recently got accredited and approved. And I'm so happy to be here today with the lineup of speakers, and I hope to contribute to the very valuable topics that they provided during this series. My topic today is original medicine perspective on handling and preparing for COVID-19 second wave. We've gone through a few months already, and now at this time we're going through the second wave. And what I want to focus on is how can we make sure that we're handling this current issue, this current program appropriately, and more importantly, how do we prepare for this second wave and for any ongoing follow-on programs. The way I look at this is kind of a wake-up call, and I'll share some of my perspective as I go through and talk about this original medicine perspective on some of the issues that are out there. But there are some things we don't have control over. We don't have control over the economic considerations, the political considerations, even the way it's being promoted by the medical infrastructure, et cetera. But we do have some control over how we proceed in terms of making sure that we're taking care of ourselves, our family, our friends and associates. And what I'm going to be talking about is the most powerful system known to man for preventing and reversing all chronic degenerative diseases. But I'm going to focus it specifically on COVID-19, this COVID-19 second wave. So with this, you see all of the different issues out there with masking, et cetera, and different perspectives on what we should and what we shouldn't do, and even some of the inconsistencies. But let's start out with inviting the Holy Spirit to be with us, and then let's proceed accordingly. Gracious Father, we praise you, we glorify your name, we thank you for your blessings. We pray that you encamp your angels around us, that we proceed in this very special time that we have together in the way that is consistent with your purpose, brings honor and glory to your name. And in that manner, I pray that those things that I prepared to speak of that is not consistent with your purpose, you override. And if there's somebody you want to speak to, and I hadn't even planned to speak about this topic, I pray that you help me to emphasize that point, so at the end of this precious time we spend together, it's a blessing and not a curse. Your will is done, not mine. If any good comes out of this time, all of the honor and glory goes to God, to you, your Son, our very best friend, our Lord and Savior, Jesus Christ, and the one and only Master Healer. Amen. So let's start off with some biblical food for thought. And the verse I picked was, my people are destroyed for lack of knowledge. Because you have rejected knowledge, I also will reject you from being priest for me. Because you have forgotten the law of God, I also will forget your children. And of course, in Amos, it tells you that God doesn't do anything that he doesn't first tell his children first. So what I hope to do with this presentation is kind of take us back to our roots. We were entrusted with this health system. No other denomination, no other organization on this planet has been given this opportunity, this blessed opportunity to have this most powerful system known to man for both ourselves and also for our own edification, for the building up of our own health and vitality, and then sharing with friends, family, associates, and with all of God's children. Here's the topics I want to cover today. First of all, let's kind of talk a little bit about understanding the difference between colds, flu, COVID-19, other viral infections, and then specifically talk to some of the COVID-19 specifics this second wave in particular, now that we've gone through the first wave and school is starting, businesses are opening, et cetera. And quite frankly, this program, since I said it is the most powerful system known to man, not only will it help us to handle and prepare for COVID-19, but for any viral disease, going all the way back to when we started worrying about this thing. I remember in the 1970s with the swine flu, and then just recently with H1N1, Ebola, SARS-1, coronavirus is SARS-2. So any viral disease or any of the plagues or any of those kinds of things. Now I'm going to focus primarily on viral diseases. For those of you who are interested, I have another presentation that talks about being prepared for all chronic degenerative diseases. But what I want to focus on here is primarily the virus diseases. This is what's topical. And hopefully you will see how you can extend and apply these principles to other serious health issues like cancer, cardiovascular disease, et cetera. So with that, let's talk first about what the difference is between cold, the common cold, and COVID-19. And a cold is basically the kinds of symptoms that you have: a stuffy nose, a runny nose, sore throat, sneezing, slight fever, cough, occasional headache. These are the major things. Now, COVID-19 does go a little bit further. The other thing about a cold, normally it lasts anywhere from 3 to 7 days. Most viruses are self-limiting, which means that, for example, with a cold, one of the expressions is, if you take medicine, if you do this, that, and the other thing, take herbs, it'll last for 7 days. If you do nothing at all, it'll go away in a week. Now, COVID-19, they're saying, is a little bit longer, anywhere from 10 to 14 days. And there are some additional things: dry hacking cough, muscle aches, headache, tiredness, congestion, chest discomfort, fever, nausea, vomiting, and diarrhea. And it does aggravate pre-existing conditions. So one of the ways I characterize COVID-19 is a cold or even a flu with a college education. Now, the symptoms, last episode, it said usually up to 10 to 14 days for COVID-19, but people usually don't get very sick and generally not sick enough to go to the hospital. And they very rarely die of COVID-19. It's less than 1%. For this reason, many people might not realize they have been affected. Symptoms of COVID-19 are similar to other viruses spread through social contact. And that's the key. And a lot of these issues, a lot of these programs are focused on this whole, what they call infection, this social spread. And some of it is clearly real. I don't think it's a hoax. I think there might be some sensationalism going on. And you'll see it basically, with an original medicine approach, it's a pretty easy thing to deal with. Hopefully you'll get that perspective. So as I said, not only will you be able to see what the original medicine perspective is, remedy is for COVID-19, but for flu, Ebola, Zika, whole host of viral diseases. And so first, let's start out with understanding what original medicine is. Now, I wrote a whole book on that. It's a required course in all of our certificate and degree courses, because basically it lays the foundation for the school, for the philosophy, the principles, et cetera. And what I want to focus on, without going through the full presentation on, is a couple of key points with regard to what original medicine is. And first of all, original medicine draws its knowledge and power, but as the name indicates, the original author and creator of both the moral and natural laws. It's a powerful set of time-honored principles and techniques for developing the whole person, body, mind, and spirit. And that's very important. Very little is being talked about in terms of the mental and spiritual implications of health. Just about everything is talking about the body. It's about masking, it's about social tracing, It's about all these physical aspects, which do have a place, but there's these other elements. And I would quickly note that a lot of the issues is due to some of the sensationalism, a lot of the lack of knowledge, and a lot of the fear and anxiety that's being caused because people really aren't aware of what this is, and there's more fear than it is that is probably called for. As you know, viruses have been around since the beginning of time. And so one of the questions you might want to ask, why this particular concern? I'll touch on that a little bit, but from this original medicine perspective, you want to develop the whole person, body, mind, and spirit. And you want to first seek the knowledge of the original knowledge giver for the most enabling and most empowering system for health and vitality, this most powerful system known to man for preventing and reversing all chronic degenerative diseases. Now, these next two charts, I just want to make a point. I spent, when this first came out, and I started to do this an Ask the Doctor series in the very beginning, from March through the June, early July timeframe on a weekly basis, kind of answering a lot of people's questions about the virus issues, how to be prepared, what to do. I spent over 20 hours studying a virology course over the internet from a professor at Columbia University, and did a lot of studying. And one of the things you find out is, this is a very complicated system. One of the things that's baffling to me is all this focus on COVID-19. But if you look at the cell, this blue here is a cell. There's all kinds of things going on there. Now, there are exosomes, there are all kinds of particles, there's viruses, there's cytocell, there's just a whole host of things going on in there. And the cell is pretty large compared to the virus. Many of you might not be aware, we have about 10 trillion cells, but there are more bacteria and viruses in our body than there are cells. There are 300 trillion cells, and they are so small that you can see they can enter into the cell. You can see we can have HIV, we can have a whole host of things in there. And what we're going to show, though, without going into all of the virology and all the epidemiology and all of those things, which, as I said, I put many hours in, I just want to let you know that let's get this in perspective. These viruses, these bacteria are a part of our immune system. It's part of the biosphere, if you will, of the system. There is the adaptive system, there is the innate system, and this whole biosphere is also something that we need to understand. And the body is designed to kind of have a peaceful coexistence, to work with them under certain conditions. One of the things that I just want to say right from the beginning, as I said, we're focusing on coronavirus. Now, they even say that over 90% of the people that are dying that have a coronavirus have other pre-existing conditions. And that's the point I want to emphasize with this chart. There are no unifactorial issues involved here. It's multifactorial. And the way it's being approached is people see what they're looking for. But what are the other cofactors? What are the other things that's also going in the cell? And they might be right there, but nobody's looking at it. Nobody's testing it. And it's these comorbidities, these co-infections, these cofactors, this multifactorial approach that we need to take into account. So while we're not going to go into all of the epidemiology and all the microbiology, et cetera, I wanted to just share with you the complexity of this, so that you can kind of have a sense of this whole peaceful coexistence and understanding there are three issues involved with whether or not you have an issue. It's dosage, it's duration of the exposure, and the third and most important thing is susceptibility. So we're going to talk about that, but let's get into a context now of why I'm saying this is this original medicine perspective is the most powerful PPE, the most powerful way we can prepare, the most powerful personal protective equipment PPE known to man. So let's look at some definitions first, and let's look at how the allopathic or the conventional medicine model is handling coronavirus, and then contrast it with this original medicine perspective that I'm talking about. And so from an allopathic model, the definition of disease is it's an abnormal condition of an organism which interrupts the normal bodily functions that often leads to feelings of pain and weakness, and usually associated with symptoms and signs. So it's a signs and symptoms approach, and that's what they're looking at. They're looking at the presence of coronavirus, and then from there, they're making a diagnosis. Now they look at some of these other cofactors like temperature, and some of the tests are looking at whether you have an antibody, et cetera. So there are other things that they're looking at, fatigue, et cetera, but they're focusing on signs and symptoms. That's the key. Now, from an original medicine perspective, in that model, disease is an effort of nature to free the system from conditions that result from a violation of the laws of health. So you can see it's a different paradigm, it's a different approach. And what I want to share with you now, where a lot of this is coming from, and some of the flaws in the thinking. Now, these aren't sinister people. They're well-meaning, and they are very sincere, but in some ways, they might be sincerely wrong, and that's what I want to share with you. So let's look at the allopathic versus the original model with this germ versus the microzyme theory. You probably never heard of this thing called the microzyme theory. I didn't invent it. It's been around for a couple of 100 years. Now let's look at where the germ theory came from, and this whole idea that we need to be afraid of germs, and we need to do something to get rid of it. As I told you, that microbiome is a part of our immune system. But let's go back to knowledge. My people suffer for lack of knowledge. Let's look at this very important perspective. Now, the germ theory actually started back in the 1600s with somebody by the name of Antoine van Leeuwenhoek. Long, funny name. He was a Dutch. He was actually a very brilliant man. And there's a couple of things he was involved with. But one of the things is he was a glass maker. And he came up with this crude microscope, and he looked at the disease material, and he said, he saw all of these little creatures. As a matter of fact, they were called beasties or animalcules. And so he's the one that first started, or he's the one that's given the credit. There were a few people around that time who talked about these little beasties or animalcules, but he's the one who came up with this, who started this germ theory that said, you see all those guys there? They cause the disease. So let's look at this now and examine this. Now you see here, and later on, by the 1800s, in the late 1800s, Louis Pasteur, you heard of him. Yes, pasteurization. Louis Pasteur is the modern father of the germ theory. Now, as I said, Antoine van Leeuwenhoek is credited with being the father of microbiology. That's when they start finding these little micro animalcules, beasties, etc. But he's the one who basically promoted the theory, this germ theory that we focus on today. And let's look at some of the key tenets of it. First of all, that germs cause disease. It produces toxins in healthy tissues. Germs should be destroyed because it will cause further disease. And germs are destructible. Now you see I have this term here called LD50, the LD50 phenomenon. Now LD50 is one of those things that all drugs have to go through in order to be improved. That's why it takes so long, up to 7 years or more, for the FDA to approve certain drugs. And one of the things they have to go through is this LD50, which is what is the lethal dose of that drug to kill 50% of the population. So the way that works is that you start with a certain dosage, and you have a population of 100%. And even if you mention it, you even the population suspects that it's in the neighborhood, didn't even apply it yet, that they die off. That's a very small percentage, 1 to 2%. That's that fear factor, et cetera. Now, LD50 is when you start out with that dosage, you see what it is, and you keep doubling it until you come out with the dosage that kills 50% of the population. That's what LD50 is, and that's one of the things that you have to provide. Now, an interesting phenomenon occurs. You keep doubling it and doubling it, and it kills more and more of the population until you get up to somewhere around the mid-90s, and you can double it and double it, and then after a while, it has no further effect. And so that can be 96, 97%. And then actually something interesting occurs. I said viruses have been around since the beginning of time. They're very adaptive. They mutate. Even this one mutates. It happens to be one of the more mutable ones. It's an RNA type virus. There are various types of coronaviruses, a lot of different classes. This happens to be a type that's very amenable to mutation. As a matter of fact, you're probably hearing in the news that it's already mutated. I'll come back to that later in terms of what the implications are for a vaccine or remedies, et cetera. But the point with this LD50 is what they find is not only does it have no further effect, but they adapt and they actually thrive on what killed most of their population. That's why you continue to see these mutations. That's why you see they've been around since the beginning of time, and they will outlast us. They'll be back. They'll be here all the way until the end of time. And that's why you're seeing a lot of farmers, for example, going back to natural farming, getting rid of the insecticides and herbicides because they're creating these superbugs. And that's what has occurred to a certain extent with the coronaviruses, these ongoing flus and different kinds of colds. Now, cold is a rhinovirus, not a coronavirus, but other coronaviruses. As I studied this, coronaviruses have been discovered all the way back to the 1960s. That's when they were first identified. So it's not a new phenomenon. This COVID-19, of course, is the 2019 mutation or version, which has the morbidity, et cetera, issues that you're seeing. So with this germ theory approach, what they use is, as you see here, antibiotics, vaccinations, chemotherapy, radiation, drugs, et cetera, because the basic principle is that they cause problems and you need to get rid of them. Now let's look at this microzyme theory. Now that was promoted, you probably never heard of this guy, Antoine Béchamp. He was a contemporary of Louis Pasteur. He was around from 1816 to 1908. And the people who promote this microzyme theory, basically, these are the basic principles. Germs result from disease. They are found in decomposing tissues and liquids. So they are attracted to disease. They're there to, as you see, germs serve the useful purpose of breaking down waste for elimination. So when von Leeuwenhoek looked in there, yes, they were there, but they didn't cause it. They are a result of it. COVID-19 isn't the cause of our problems. It's a result of our health issues, or a result. It's not a cause. And so you'll start to see where even scientists, what you're seeing is those that promote the popular view of the germ theory. There are other microbiologists, there are other virologists, there are other epidemiologists with another view, scientists and medical doctors. And that's the side that the original medicine sides are with, and you'll see why soon. So the final point I want to make is germs adapt to its environment. If the environment is a good environment, they do good things. They peacefully coexist, and they make your vitamin B12, et cetera. And if it's bad, and they proliferate, then that toxic waste puts a burden on the system and causes other collateral damage. So from a original medicine perspective, we use, or that promotes the use of probiotics, herbs, diet, lifestyle, environment changes. It's a drugless approach. So all these germs and diseases, they are scary looking. They're fearful. But you know, one of the things is they look big and ugly. They're not the size of dinosaurs. When you look at the cell size is measured in terms of what I call microns, or millionths of a meter, which is kind of small. You can't see it. Germs and viruses in particular, which are smaller than bacteria, they are measured in nanometers. Nanometers, billionths of a meter. That's why they can get into the cell, and quite a bit of large numbers. But let's look at the fundamental principles from an original medicine standpoint of germs and disease. First of all, germs are the lowest form of life, incapable of attacking or killing anything. Germs are scavengers and decomposers, totally dependent on waste to survive, totally depending on a live host. And so some of the things you'll see, it does make sense. Some of them asking, I'll talk about that. Why some of that makes sense. It does transfer, and it does have to find waste, and has to be in a living host. It does decompose body waste that irritate the system and signals the need for eliminate. And in that process, if there's too many, they might even contribute to that waste that needs to be eliminated. Disease symptoms are not the disease, but rather the symptoms of the disease. So you are treating the effect rather than the cause. And then consumption and injection of toxic substances suppress the immune system, and nourishment and toxic elimination prevents and reverses these systems. So I'm going to go to the context. As I started to mention earlier, I have a more broader context of the 10 underlying factors for all chronic degenerative diseases. And as you can see, the first one on this list is infection. That's what I'm going to speak to. But what I want to emphasize here is this is not a theory of mine. This is what I did was I took the medical approach. This is what medical doctors go through. One of the books that we use, it was provided by a teacher that teaches pre-med students. And in medical school, you see this De Gouwen's diagnostic examination. In that, all medical students have to go through that. And in that, they go through these 10 factors underlying diseases. Now, certain variations of the book, I saw as little as 9, as many as 12, but these are the general categories. Now, Susan Turley, the author of several of our texts, Anatomy and Physiology, Medical Language, etc., in her book, this is the 10 that she talks about, which is what she teaches to medical students. And I have them all here. I'm not going to talk about these others, but you can see what that full scope is. And I have another presentation that I would be happy to point you to if you want to see how you can address all these issues and basically have the underlying original medicine approach for all chronic degenerative diseases, including cancer, diabetes, et cetera, which falls under these 10 factors. So what we're going to look at is infection, and let's look at the medical approach versus the original medicine approach. And here is the conventional, here's the medical approach, remedy, and you know them. There's social distancing, there's testing, there's social tracing, there's masking, there's hand washing, antibiotics, antiseptics, vaccinations. It's what I call, kind of the fear thing, and you have to, you can't be associated with the germs. You have to keep them away from you, and then if you get it, it's what I call the hand grenade approach. So if you had a bunch of germs, for example, in this room, they're too small to see, but let's say they were mice or roaches. The hand grenade approach is you throw a hand grenade in there to kill them off. That's what the antibiotic the hand washing and all of that does. The problem with that is doing too much of that, too much of the antiseptics. You're going to wash the paint off of the wall. Now, of course, the hand grenade is going to kill most of them. Remember, I told you, as we indicated in the LD50, you're not going to kill them all anyway. You're going to get most of them. Some of them are going to survive, and then they're going to create even more havoc. But with this, with the hand grenade approach, even if you get most of them, you're also going to create a lot of collateral damage. Now, with the original medicine approach, if you remember that model, it's the violation of the laws of health. So in the original medicine model, you want to avoid the causes and contributing factors. And it's more than just the coronavirus. Remember I said it's multifactorial. What are the other contributing factors? Now we know pre-existing issues like inflammation, some of the other things on that previous chart that we talked about. We know that those are some of the things, but what are those other factors in the body already that we're not looking at? Now, of course, inflammation is there and things like those, but what about other germs, other factors, other visible, invisible factors that are going on in the body and cells that we don't even have a disease name for. As I said, those 300 trillion other bacteria, et cetera, those comorbidities, co-issues. And so from an original medicine standpoint, we want to focus on cleansing and rebuilding, and there are natural original medicine remedies. And that's what I want to focus on for the rest of this program. So first, let's focus on what the Bible says in Mark 3:27, which I thought was very appropriate. And when I talked about, susceptibility, I talked about dosage, and that's important. So the amount of dosage you're exposed to, the duration, so you're spending a long time in a room with all of these germs in the air, in the environment. You don't have a problem outdoors, which we'll see in a second, or nowhere near as much. But it says, no man can enter a strong man's house and spoil his goods, except he will first bind the strong man, and then he will spoil his house. So in order for COVID-19 to thrive, the powerful immune system must first be weakened. But see, what if you're susceptible? What if you're not susceptible at all? It can't have any effect on you. So that's what we're going to talk about. So what binds the immune system? Well, first of all, I'm not going to go through all of this, but the point I want to make is we said these viruses, these bacteria are there to clean up waste. It's all, and we have these 5 organs of elimination. When they get clogged up from dietary, lifestyle factors, polluted air, food, polluted water, even medications, grooming products, household products. I have some of the physical things. What about the mental and emotional, fear, anxiety, spiritual issues? None of those, all of those things add to that toxic accumulation that makes us vulnerable and susceptible to viruses, COVID-19, et cetera. So what I want to focus on is 7 original medicine COVID-19 remedies. Now, in the longer presentation, I have 12, but this should give us enough to show how empowered we are to basically deal with this. Now, there, of course, the common sense things that are being talked about, even without coronavirus, and just in terms of respecting other people's dignity, et cetera, coughing into your elbow, blocking, and masking if you're going to be in public. Although even they are saying it's not designed to protect you, it's designed to protect others. But if it can't protect you, I don't know how it's going to protect others. And quite frankly, if you understand what I said about nanometers, if you can breathe, and they even say you get some, it doesn't eliminate all. But remember we said dosage, duration. So yeah, it does minimize it somewhat. And it is a sign of respect to wear it. And quite frankly, it's the law. and we ought to obey the government as long as it doesn't violate the God's law. And so even when I go into, I don't argue, I don't fight, I don't give a lecture on the germ theory. I put on my mask respectfully, and quite frankly, not because I believe it's helping me or anybody else, but out of respect for those that have very real fear and anxiety, and you can see it in their eyes. So all of these common sense things, even if you have a temperature, you stay home. You want to avoid large. I didn't like large crowds without coronavirus. I mean, I get the heebie-jeebies when I'm around a whole lot of people. So that just adds another element. So a lot of the common sense things I'm not going to focus on so much, but some things are kind of common sense, but we're really not focusing on. So that's what I want to talk about in terms of these 7 things. And the first is so obvious that it probably is laughable that I talk about, but fresh air and sunlight are one of the most powerful ways of dealing with the coronavirus. As I said, even in fresh air, I don't really see, I don't understand people at the beach wearing these masks. The fresh air, the sunlight, it just destroys them. It even if it doesn't destroy, it attenuates, it weakens them. So they really don't have that good of an effect. So fresh air, and the reason why I put these on, even though they're obvious, fresh air and sunlight are very, very powerful, have effects on the immune system. I don't even have time to go into all the details. I'll tell you a couple of, I didn't realize that. A lot of people think they get a lot of their health and vitality, their health and vitality energy, they think it comes from food. I'm not going to go through all the details. I have all of the backup for you, which I'll come to later on. But 80% of your health and vitality comes from air. And I'll just make one of the points that I make in the more general presentation. How many meals a day do you eat? You eat about 3 meals a day, or maybe 5 meals a day, 7. Even if you're crazy, you don't eat more than 10 meals a day. But how many meals of air do you have a day? Well, you breathe at least 10 to 20 times per second. It's a 24/7 kind of food, and air has nutrients in it. Like I said, I'm not going to go into detail, but air has a lot of powerful nutrients that promotes the functional integrity of your vital organs, your immune system, your liver, which requires oxygen, water, calcium, etc., iron, iodine. But without air, without oxygen, none of those things can actually take effect. So you can give the best food you want to a dead man, then it's not going to help them. The same thing, if you don't have oxygen, all those other things are rendered ineffective. So air is very important. Sunlight is very important. And the reason why I brought this up is the last thing you want to do is stay in the house all the time, which is what they did with the lockdown. Open, especially during this time, open the windows, get some air in, put plants in the house if you need oxygen. Get as much as you can. And even in certain instances, if you're particularly vulnerable, and I'll come back to this later, what we need to be doing is focusing on a program for the vulnerable, not for the 99%, but the 1%. For that 1%, if they don't have access to the sun, maybe they should have access to ultraviolet lamps, to vitamin D3, based on their requirements, capacities, etc. And as I said, plants, etc. Little fresh air to provide this very, very powerful original medicine antidote, prescription remedy for enhancing the functional integrity of our system and making making us less susceptible to the corona or any other virus. The second one also might be intuitively obvious, but I want to mention here is eternal and external water. And the reason why I brought this up, everybody knows the water, everybody knows the guidelines, which is a little bit off. But the key I want to make here is a lot of people are doing good things wrongly. What I mean by that, they might be drinking the right amount of water for their guidelines, but they're drinking it wrongly. The body can only handle about 4 ounces of water at a time. So those clients of mine and those who are taking their water and drinking it, and they come to me, they brag, well, I have 2 glasses right in the morning. And sometimes I have my liter first thing in the morning before I go out. I said, you must be spending a lot of time in the menu. Oh yeah, how did you know? Well, your body can't handle it. You're overriding your system. But when you sip it, and the ideal, not practical, but the ideal, every 15 to 30 minutes, like 2 to 4 ounces at a time based on your requirements and capacities. It goes all the way out to the fingertips and all the way out to the ends of the toes, cleansing and carrying electrolytes and waste, etc. Whereas when you put too much at one time, you're just basically overloading the kidneys, and you're not getting that full value of the water that washes out the viruses, the bacteria in the stomach, in the mouth, and also bring in nutrients. It's the most important catalyst. And I said, internal and external water, viruses are heat sensitive. So your temperature is your antiviral. So external use of water, hydrotherapy, is the use of water for both internal and external use, and using varying temperatures for therapeutic purposes. So let's focus in on this a little bit. Some of you know this, but again, some of this knowledge, this basic, simple, time-honored knowledge that God gave us, we should be understanding, we should be revisiting, we should be applying it to ourselves so that we can confidently take care of ourselves, our family, and those, our associates, friends, and others. Hot bath, a hot foot bath, or contrast shower, hot water is very, very powerful immune enhancer. As I indicated, maybe I didn't, most viruses and bacteria can't function above 102 degrees. That's why fever is your friend, not your enemy. So yes, if you have a fever, stay home so you can cooperate with your body, but that is your help, that's your aid. And quite frankly, most of us, I'm one of those, and I'm particularly sensitive. See, one of my predispositions, my major issues when I talk about being blessed with poor health was chronic respiratory issues. I used to have chronic bronchitis multiple times a year, all the way up until my 40s, before I started making changes in my health, etc. So I'm very sensitive to this. And the point is, I used to think I had to reduce my fever too. Fever is your friend. And one of my problems is my body usually doesn't get hot enough. My normal temperature happens to be 97.8. It's very difficult to get into 98. So one of my issues was my body wasn't getting hot enough. So even for me, when I get into the hot tub, I have to get the water. Now I can't get into the water at this temperature, but I have to get the water. I had to get the water up to 117 degrees to get my body up to 103 degrees and hold it there for 30 minutes to half an hour. So I had to get in at about 102 to 103 degrees and have my wife pour boiling water, not on me, but in the water as I move my feet to the side to get that water up to that temperature in order to get that. So that's why you keep hearing me talk about individual capacities and requirements. But that's what that hot foot bath does. It increases the peripheral circulation, increases the metabolism, the perspiration. It gets that blood circulating through very fast. It elevates that temperature where that diol can start occurring above 102 degrees. It relieves pain, stiffness, fatigue, congestion of the internal organs very well. So heat, hydrotherapy, temperature is your friend. The hot foot bath, same thing. It increases the blood flow. It'll pull congestion out of the head. It even relieves a headache. It's relaxing. It's comfort. It also treats local inflammation in the feet and also has an effect throughout the entire body. Here's my favorite. I do this often during the wintertime. And it's what is called a contrast shower. It's actually a blood massage. You're in the cold water for 1 to 2 minutes, and I mean the hot water for for 1 to 2 minutes, and then in the cold water for 15 to 30 seconds. Now, if you can, and if I feel particularly stressed out, etc., I stay in that cold for the third iteration for up to 5 minutes, 7 minutes sometimes. I'm not recommending that. All you need is 3 iterations for the therapeutic effect, and 15 to 30 seconds is usually fine. And you always end on the cold. And so the hot water will cause vasodilation, and then the cold will cause vasoconstriction, and it pumps through the system, and it really enhances the metabolism. And it's a very, very powerful, as I said, blood massage, which moves the waste out of those organs and moving nutrition to them. The fourth one is avoid the no-no foods. So you want to avoid those things that are contributing to the problem. So milk, dairy are the most mucus-producing, the most acid-producing food you can put in your body. So you want to avoid those kinds of foods. You want to avoid those things that you need, you have food sensitivities to anyway. Gluten, genetically modified organisms, etc. And AMAP stands for as much as practical, as much as possible. You want to avoid refined carbs. Some people think sea salt is a cure. I'll have a whole different sense of reasoning to show why some people are making a mistake. Again, based on individual requirements and capacities. And if we have time during the question and answer session, I'll deal with any things that you want to talk about a little bit further. But chocolate, which affects the nephron tubules, causing constriction in the kidneys, etc. You want to minimize meat if you're under the age of 12. So watching out for your kids now. And you want to minimize nuts and seeds for those under 8. The digestive juices just aren't strong enough. Quite frankly, some adults, their immune systems are weak. And I'll talk about, if we have time, if there's a question on it, there's a very powerful system that I use for analyzing people's health rather than diagnosing. Diagnosing is guessing and using your experience. Analyzing is basically looking at what's going on in the system, and it is the most powerful. It's a mathematical formula for equation for perfect health, which is another thing. But basically, working with people based on their requirements and capacities, and avoiding those things that are a problem, and using healthy things as a swap. So instead of the candies, the fruit, the vegetables, instead of salt, herbs that have the electrolytic effect, instead of butter, avocado, coconut oil, instead of cow's milk, almond milk, cashew milk, etc. Instead of cookies, cakes, pies, candy, bagels, more appropriate kinds of complex carbohydrates. The fifth one is for a sore throat. You can gargle with any combination that's available of activated charcoal solution. Apple cider vinegar is one of my go-to favorites. You don't need that much. You just put a little apple cider vinegar. You get about 2 ounces of it. You can use salt water. You can use golden seal solution. Whatever is available, and we'll talk about some of these other things that you can use that are very, very powerful natural antimicrobials that don't compromise the functional integrity of the immune system while being very antagonistic to the viral, bacterial kinds of issues. Or you can even put a heating compress to the throat at night. So these are the things that will relieve the sore throat. And I'll talk about some other herbal things when we come to the COVID-19 shot remedy, very powerful remedy that I talked about on Ask the Doctor, etc., that I'm going to share with this audience as well very soon as you proceed to this. So any of those things, and you want to gargle, and you want to let just a little bit go down the throat, so it'll clear out the mucous membranes, the tonsils, etc., and it will go down into the system to prevent it from getting into the lungs and getting into the tissues and creating a whole bunch of havoc. So then number 6 is avoid antihistamines and antibiotics as much as possible. I already talked about this, the hand grenade approach, but it is a whole host of other issues. And quite frankly, antibiotics have no effect on viruses anyway. the antibiotics, antibacterial. So why do they do it? There really aren't very good antivirals out there. They're even trying to find one now for coronavirus. But and some of the reason is good. They do it prophylactically. And what they're saying is if you already are inundated, exposed to, and are vulnerable to viruses, you are susceptible to other bacteria. So prophylactically, they will administer it because that's the best thing, and that's one of the more common things that's available. But it's one of the primary causes of antibiotic resistance, yeast infections. It dries out the system along with antihistamines. They're too dehydrating, and it can cause what is called a cytokine storm and other immune responses. And what that is the body is already assaulted and already impacted with this virus and other cofactors, and then you bring in this other alien thing, and attacking and trying to get a control of the virus and bacteria is also attacking this, trying to get rid of it. It's a poison. It works in terms of killing them, but it's also creating all this collateral damage. The system has to get rid of it, and so attacking it, it actually overwhelms the immune system with all of these things for survival. And so that's what's causing some of these effects of some of the well-intentioned medical approaches that are causing this cytokine storm, which then they require CPAP, BPAP, the ventilators, et cetera, because of the lung tissue gets assaulted, it blocks up, it tenses up, and too much inflammation, and air can't be processed, et cetera. And then you get into this cascading issue, which is where a lot of the people are dying from the treatment of it, as opposed to doing some of these more natural things that puts it at bay, comforts the system, and works in harmony with the immune system. And number 7, you want to, now this is very controversial, and I respect those that believe in it, but there's a lot of literature that basically shows, and I have there's thick books written on it. The back, the vaccine myth. Very good websites. Vaclib.org is one. Vaccineliberation.org. Another one is the Vaccine Information Center. So there are a few really good websites with a lot of good information, a lot of good books on it. And virologists, epidemiologists don't agree with it. But you know what? What I wanted to focus on, first of all, there's very limited, valid, peer-reviewed studies and they have questionable efficacy. And most vaccines that enter the market when disease has ended the life cycle. Look at it yourself. When the polio virus vaccine came out, the AIDS, the AIDS didn't have a vaccine, but a lot of them, basically, by the time they came out, remember I said they were on the decline. So you would look at the curve, it went up, and on the way down, almost at the end, it came out, and then it was taking credit for getting rid of it when it was at the end of its life cycle. Vaccine producing companies are immune from liability. Back in around the 1980s, most of the vaccine companies weren't producing the vaccine because people were having problems, et cetera, and they didn't want to be sued. They didn't want to go bankrupt. So there's a law on the books that basically gives them immunity from the law, and we pay, the taxpayer pays any of the effects, et cetera. So that might want you to question this whole process, this special fund. And there's potential for mild to severe neurological damage to developing children in particular, who already has their developing immune system, but even adults have a somewhat compromised immune system, and there can be some serious problems. So do your homework. My people suffer from lack of knowledge. If you believe in it, fine. And the good news is most of us will be able to, as I said, the cytokine storm, be able to fight it off. But for that 2 to 5% that it can't, if it's your child, if it's your family, you don't care about statistics. You are the ones that wound up with this problem, et cetera. So just be careful, do your homework, and I'm going to share with you especially as these laws come out and it's mandated. First of all, let's understand what some of the possible issues might be. And then I'm going to share with you, because I get calls literally from all over the world. People, well, what do I do? I'm in this country, I'm in this state, I'm in this job, I'm a nurse, I have to do it for my job, etc. So I'm going to share some perspectives with you. So how you can minimize and reverse potential damage. But look at some of the ingredients. Thimerosal as a preservative, aluminum as an adjuvant, pus from sores of diseased animals, horse serum, fecal matter, macerated cancer cells, formaldehyde, gelatin, phenol, retrovirus SV50, a contaminant virus that is used in some vaccines, antibiotics, and they use various viral RNA byproducts, MSG, squalene as an adjuvant, and other carcinogenic substances that are capable of causing paralysis, convulsions, coma, necrosis, gangrene, damage to the brain, the nervous system, etc. Now, most of us might just have a mild reaction, but some of us who are vulnerable, like those in particular that are vulnerable to the COVID-19, etc., you might want to do some homework and proceed cautiously. And I'll show you some things that you can do if you feel you have to do it. And I respect people where they are. If you want to believe in it, people believe in all kinds of things. There's literally thousands of denominations. There's only one Bible, only one truth, but many different viewpoints. But there's many ways of practicing the healing arts. And my favorite author outside the Bible says there's only one that heaven approves. And vaccines is not a part of this original medicine approach. So let's talk about some things that we can do that are original medicine, practical, safe, effective, easy to use approaches for cold, flu, viruses, etc. And I'll also touch on, if you have to do the vaccine or you decide you do it, here's some things that you can do that is safe to help mitigate the damage. The first one is nature's COVID-19 flu shot. And this is what I was recommending to my clients during this 12-week period when I was doing Ask the Doctor, free seminar series, etc. And even with my clients, my students, etc. The major ingredients, the foundational ingredients are the first four: the honey, the garlic, onion, and lemons. And then based on your requirements, capacity, the horseradish, the peppermint oil, cayenne pepper, you want to blend that concoction. You can put some other things. There are some other herbs. People want to put some of their favorites. People give me all different variations to the formula, and they are quite effective. This is the one I like. This is the one I use. These ingredients are very easy. It works very effectively. And then after you blend it, 1/2 to a teaspoon every half an hour. And for acute issues, you can do a tablespoon. You can do it every 15 minutes. And again, based on requirements and capacities. I use it for myself, my family. I had a couple of instances for young people. I had one 22-year-old person. After the third dosage, she felt better. And I had an older client, the mother of one of my clients. She said after the third day, she never felt better in her entire life. She started exercising for the first time in over 20 years. And I said, whoa, time out. Don't burn up all that energy. Your body needs that energy to complete the healing. So people are getting very powerful effects from this COVID-19 flu shot, or this COVID-19 natural cough remedy. And again, based on requirements, capacity. It can't hurt you, and you can change the ratio of composition based on taste, etc. I prefer it particularly strong. As you know, garlic is a natural antiseptic. Onion is one of the most powerful bioavailable forms of vitamin C that all different kinds of people take. You have to be careful with vitamin C. Everybody needs it. Everybody can't take over-the-counter vitamin C. And there are reasons for that based on pH, etc. But everybody can take this onion soup. And I'm not talking about the onion soup I mean, onions, cooked onions in this particular. I'm talking about raw onions. I'll come back to onion soup in a second. But onions can be taken every day in raw form than cooked form. There are a number of other antivirals. Oregano oil. Remember, I talked about the gargle. If you don't have access to gargle, you just have to carry this little ounce that you can carry in your purse and your little first aid kit in your car. As soon as you start feeling that little tickle, put a couple of drops under the tongue. You do that for about 2 or 3 hours, and it'll knock it out before the end of the day. Stabilize allicin. Allicin is that active ingredient in garlic. As you know, garlic is the smell, the odor. It's inert. When you cut it, when you crush it, when you break it, there's an enzyme called allinase. It interacts with that allin, and it makes allicin, which has that powerful antimicrobial approach effect. I mean, and it's more powerful than even antibiotics for many viral and related issues. White willow bark is natural aspirin. Olive leaf boneset is what was used during the Spanish flu that had very powerful effects. Glycerated golden seed. There's a whole host of them. And you see I put, there's at least 15 or more antivirals that are available. This is what I want to focus on and pay a little attention to for a quick second, and that is activated charcoal. It's very, very powerful. And remember when I said one of the things that you can do is if you have a choice with a vaccine, and they're talking about maybe coming up with an oral vaccine, if you have a choice between the needle injection or the oral, take the oral. And let me tell you why this is so powerful. For me, if I have to take it and they twist my arm, I'd rather them take the needle and put it in my throat and let me swallow it. And that's what I would opt for, because it's going through the normal system where you have all of the natural barriers, the innate, the adaptive system, the microbiome, et cetera. And that is a much more natural way for dealing with even the bacteria. It doesn't come in straight in through the blood. It comes in through the nose, the mouth, et cetera. And so if you take a teaspoon and put it in a glass of warm water and you swallow it before you take even medicine, so you don't take it if you need the medicine. And medicines do have an approach. That's not the top, does have an applicability. It's not the subject of this presentation. That bigger presentation where I talk about a cure for all diseases, I talk about where it is most appropriate. But in terms of this, if you have to take a medicine, or if you have to take this first, it'll completely neutralize it. Charcoal adsorbs more than 600 times its weight. So a teaspoon, I mean, it can cover 600 times its volume and weight in germs, etc., poisons, etc. You can take the tablets, or you can take, which might be practical, especially if you're traveling, to have it, to use that, especially if you go out to eat and you're not you're worried about food poisoning, things and for you can make a paste or a poultice. Why do you need the paste or poultice? If you have to take a shot, and if you have that little paste or poultice in your car, as soon as you get to your car, you put it on there, put a band-aid, it will adsorb all of those poisons right out of that mark. So it will help to minimize and mitigate that local inflammation and that local accumulation of poison. It'll pull it right out. It adsorbs very, very well. Here's another one, heavy metal detox. Some of those adjuvants, some of those things in the vaccine are heavy metals. So why do they have these adjuvants, you might ask? Good question. The virus itself is usually an attenuated or a weakened virus. It doesn't have any effect. And it's kind of telling you that they need to kind of give it a boost for your system to react to it. So the first question I ask is, if you're wearing all these masks and everything, and you have to avoid it, help me to understand how injecting yourself with a super energized, a super activated, an empowered, super empowered dosage taken directly into the body, bypassing the system, how that's really going to help. And anyway, the reason why they're doing that, because they want to enhance that effect to stimulate the immune system to work. So it does seem to have a measure of common sense. But if you believe in the germ theory and you're trying to avoid it, you know, one of the things that I ask rhetorically, if you really believe in the germ theory, why would you go to the hospital for anything? That's where all the germs are. You probably want to go someplace where they don't have germs. And well, anyway, what this heavy metal detox will do is if it's already in the system and you already had a flu shot or multiple flu shots over the year, and you have some of these symptoms, you can do this, what is called this chelation pesto with the major ingredient cilantro, and there's garlic again, and a few other things mixed together. And it basically will adsorb and pull those heavy metals out of the body. That thimerosal, the aluminum, and some of those other heavy metal and other toxic things. And then for younger children, even for adults, you can actually use the coriander seed powder, which is basically what cilantro is. It's coriander in the green leafy form. And you want to do 1/4 to a half a teaspoon. And for children, you want to put it in applesauce. You can do it for adults also. And you don't want to do more than a half a teaspoon. And that's all you need for about 6 weeks. And that will pull those heavy metals out of the body. Vegetable broth is highly bioavailable. It's a liquid mineral cocktail. It promotes fever therapy. And remember, coronaviruses are destroyed by heat. Plus, you're providing all of these minerals, all of these phytonutrients that your body needs to improve the functional integrity of the organs and your immune system for making you less susceptible. And then this is where the raw onions, garlic, ginger, cayenne pepper, etc., can be added to really give you a mineral, phytonutrient, natural antibiotic, natural grenade, hand grenade to get rid of those that excess viruses, microbes, those other cofactors that they're not measuring without impacting the functional integrity, but actually adding to the functional integrity of the system. And here's that onion soup. If you know you're vulnerable, if you're part of that 1% or 2%, or you have pre-existing conditions, I recommend having onion soup at least 2, 3, 4 times a week. And I'm not talking about French onion soup with the cheese and everything. Here are the main ingredients. Mainly onions, water, celery, peppers. You can put up to a pound of onions in that water. Distilled water preferably. Some of these other things, a pinch of cayenne, ginger. Simmer for 15 to 20 minutes and don't overcook. As a matter of fact, I told you about the woman that basically after 3 days, she fell in love with this onion soup. It's a regular part of her staple. And she's probably given her all of this vitamin C that she needed. Now, vitamin C, vitamin A and vitamin C are very, very important for cell structural integrity. And most people we don't make enough vitamin C. We make a little bit, but it's not like animals. We don't produce sufficient enough of it. So we have to get it from an outside source, from food, etc. And as I said, there are some herbs like camu, acerola, rose hips that are high in vitamin C, but they're kind of esoteric. They're kind of sometimes difficult to get. Everybody has access to onions. Onions has the highest vitamin C, bioavailable vitamin C. And what the vitamin C does is if you have a house made of brick, and the brick is to protect you from things coming in, bricks can be porous, and if things can get through all the holes and everything, then air and all these dust particles, etc., can come into that house and invade it and overload it. What the vitamin C is, provides that cement so it can't get in, and that's part of the thing that keeps you from being susceptible. So it can get in, but it can't get access to the cell because you got all this cement. It has all of these troops out there standing guard to keep the viruses out and letting in only a little bit at a time that you can handle very easily. So you're not getting that high dosage and or over a long duration of time. So vitamin C provides that shell of protection. And all the cells need vitamin A. I'm not going to go into all the details here and how the the cell structure works and ionization and everything. But essentially, it's a very important vitamin. It's a very good bioavailable form, and make this a part of your regular regimen for that handling if you have an acute issue, or preparedness if you know you're vulnerable. But so as I'm ending up, the most powerful PPE, the most powerful personal protection equipment is a strong immune system. Not all this packaging is not practical anyway, and some of these things, the social distancing and everything, is not going to work, and it's not practical. Even now, they're saying, well, maybe we. Then I saw them talking about, well, maybe we're only going to test you if you're symptomatic, if you're not et cetera. So they're actually learning a lot, and a lot of this overkill with PPE, et cetera, might not be practical. And if you can breathe, if the air can get through, then you are vulnerable. Remember, nanometers. These are 5 microns inside. These are tiny guys, and they can get through the cracks. Now, of course, the PPE does help, and it does have some value. But the most powerful PPE is that strong immune system. And so, as I end up, if thou wilt diligently hearken to the voice of the Lord thy God, and do that which is right in his sight, and will give ear to his commands and keep all his statutes, I will put none of these diseases upon thee, for I am the Lord that healeth thee. So as I started out, my people suffer for lack of knowledge. Let's get back to the original author and creator, and all of that good biblical information, all that good information he's given us on the counsels and diets and foods, counsels and health. We are the carriers. We are the keepers of these laws, the keeper of this most powerful system known to man. Let's go back to our roots. Let's go back to our heritage. Let's trust God. Let's trust in divine power. Trust in again, Proverbs 3, 5, and 6. Trust in the Lord with all thine heart, and lean not to thine own understanding, or the understanding of the secular world out there. They're well-meaning, but sometimes misinformed. They're sincere a lot of the times. Let's assume that when they are sincere, they are sincerely wrong. God already, who provided the blueprint, he gave us this system. So let's go back to our roots, and let's understand there's no PPE strong enough to protect us from COVID-19 and its mutations. We need to suit up with the full armor of God. Go back to Philippians. Make that your mantra. Understand it. Put on that full armor of God, and be prepared. I talked about just the physical thing, physically, mentally, spiritually. It's the most powerful system known to man. And I want to end up kind of saying, let's understand this original medicine approach. This is it. This is what he's given us. And understand, trusting in him and all of these laws. These are it. This is it. I didn't go through all of them. I talked a little bit about open air and sunlight, but all these things, it's not multiple choice. It's not 1 out of 8. It's all of them. Starting out with trust, and you demonstrate that trust by doing it his way. There are many ways of practicing the healing arts. There's one that heaven approves. That's original medicine. And so, as a summary, for handling and being prepared, trust in divine power first, and then all these things which we kind of talked about, all of these things put together in an integrated and a comprehensive way is the most powerful system known to man for handling and preparing not only for current coronavirus, but the second wave, third wave, and what it's really getting us prepared for is not this, but this next follow-on. So this is a wake-up call. This is an opportunity for get us really prepared for what's really coming down the pike. Because if you think this is the end of it, mark my words, next 2 to 3 years, 3 to 5 years, most, there's going to be some other issue, some other mutation. So here's a good opportunity while it's mild. And obviously before the plagues come upon us, let's start getting equipped and qualified in the most powerful system known to man. And let's understand, God is in charge. Why we're doing this, and so this is not so that we can be powerful juggernauts. It's so that we can be in harmony with Him. And so I like to end up with one of my favorite verses: whether you eat or drink or whatever you do, let's make sure we're doing it for the glory of God. And He will guide and direct us in all ways. And He will put that X on, and that will put that X on the goalpost. It will bypass us. It will not touch us. And when we go into that fiery pit, it won't burn us, it won't touch us, because He'll be in there with us, providing that most powerful PPE known to man. So at this point in time, I'll be happy to answer your questions and answers. If I run out of time and we don't have time, I'll be happy to entertain them. Again, we're the International Institute of Original Medicine. I'm the president and CEO. I'm the pretty face of the organization, as you can see. But my wife is the executive director. And if you were wanting to get something done, you find a woman. She does the day-to-day operation. She runs it. And together, we are just honored and blessed to be able to provide this education. IIOM online is where you can get more information, and info at IIOM online. Any of those things that are controversial, things that you'd like me to give you the backup, the references, I have files of things. But in the interest of trying to get this in some meaningful time frame, I wanted to just show you how we can be equipped and qualified with handling and preparing for corona or any other kind of virus with this most powerful system known to man, giving God all of the honor and glory. And I'd like to thank you for your time and kind attention. I hope it was of help to you, and for the kind audience out there. On behalf of myself, my wife, and all of us at IIOM, we want to wish you health, happiness, and God's richest blessings in your health, and all of your medical, missionary, and other endeavors. Bye for now, and God bless.